Ladies and gentlemen, welcome to another episode of James's Corner. I am your host, James Richardson, and today I have a very special guest on. I'm a friend of mine. We've done a lot of work in the cystic fibrosis community. She's going through a little bit of a struggle with the illness right now, so I thought it would be important for the community of cystic fibrosis warriors, but also people who don't know too much about the community to have her on and just share her story a little bit. My friend Rima is here today. Rima, can you just introduce yourself to the audience and just tell a little bit about yourself? And I appreciate you coming on as well.
Sure, of course. My name is Rima and I'm 35 years old. I was diagnosed with cystic fibrosis at 4 months old. Um, and I got my first double lung transplant May 14th, 2017. And this fall, I started showing signs of rejection. I didn't know at the time it was rejection, but I started feeling short of breath and everything went downhill. And I am now with Duke. I haven't been listed yet, but I'm just waiting around doing rehab and any other testing and appointments that they need before they can list me.
Wow, I'm sorry. I want to just move a little bit back. I want to start from the beginning just a little bit. So just for the audience who's not clear of what's kind of going on in your life, you've already had a double lung transplant with cystic fibrosis. Now, and a lot of times with these double lung transplant, the body starts to reject the transplant, correct?
Yes.
And then you have to get another transplant. So we're in that process now, but I want to start in the beginning. Can you just walk us through your journey with cystic fibrosis and the thoughts and things that you were going through during the first time where you had to get a double lung transplant? Like, how did you react to that? What was that, the emotions and the feelings that you had to go through in that?
Right. Okay. So the first time that transplant was ever brought to my attention was, I think, sophomore year of college. I was already down to 30% lung function at the time. And of course, like that, just them talking about it back then scared me. But I had time before I actually had an evaluation done, and this was in Boston. So I did a transplant evaluation in 2012, but I was deemed too well at the time. I wasn't on oxygen yet, and my quality of life wasn't awful, but they're like, we'll keep an eye on you. So, and then I decided I wanted to move to Colorado, and I got really sick before my move date, of course, and got put on oxygen. And I still went and moved to Colorado, where there's elevation. And then my team in Boston was like, you need to get in a transplant center and get on a list ASAP. And so I went to Colorado, met with the team. They decided not to do my transplant because the bacteria in my lungs were too risky, even though it wasn't anything crazy. They just didn't want to take on the risk back then. And then my sister went researching and found the U of M in Minneapolis. And so did the evaluation there, and they accepted me. Um, yeah, it was a lot of stress, anxiety, trying to navigate everything. And my sister became my caregiver. She, left her life in New York and came to come help me, and which was amazing. I didn't even ask her to do that. And so then I got listed in Minneapolis, I think the fall or September of 2016. And then I had 2 dry runs, which is when you get the call for lungs and it gets canceled for one reason or another. The first time for me, it happened on Halloween, and the second time happened on April Fool's Day. And then I got my third call the day before Mother's Day, and the surgery happened on Mother's Day.
And sorry to interrupt there, Rima, but what is the reason they would do that?
The dry run,
Yeah.
like when they take a second look and the lungs look like there's infection or something's wrong with it. Uh, yeah, but
Okay. Okay. So that's the
for
reason
some
why. Sorry to
reason
cut you off.
they waited till I was already intubated and put to sleep for the first one before they
Oh,
canceled it. So
really? So they put you asleep and then they canceled it.
yeah.
Interesting. So they find a certain bacteria. Is that what it was?
No, the donor lungs
Mm,
seemed to have like and looked inflamed. And I'm
I
like, how
see.
did you
I
not see
see.
that before?
Yeah, exactly. That's a little bit interesting. Okay. Sorry to cut you off. Sorry, continue.
No, you're good. Um, I don't remember where I was
Yeah.
at.
Sorry. Yeah.
Oh, you're
Um,
good.
no, it's okay. So yeah, I just want to obviously that's so brutal and so it's you had a rough pat like it wasn't smooth. Like it wasn't like, okay, you need a double lung transplant, let's get you in, take care of it, and then that's it. It was kind of a little bit of a hectic up and down during the process of all this.
For sure. Yeah. And I waited 8 months on the list.
And
Um,
wow. And what percentage were your lungs at when they told you needed a transplant?
it was 30% when they told me back in 2009. And then when I was in Boston, I made it down to like 19%
Wow.
right before I moved to Colorado. And then um, it was still kind of 1918 once I like made it my way to Minneapolis, but
Wow.
my need for oxygen went up. So I needed like 6 liters at rest and like activity. It was always at 6 liters, which was a lot for,
Wow.
well, it's not that much. I mean, it's still a good amount.
Yeah, yeah, absolutely. So let's talk about obviously we were talking about the process of the getting to the transplant and how awful that is, but let's talk about the actual transplant and if you could go into detail about the process of how that works and kind of from your perspective going through that because I have a lot of other friends in the community that have had transplants and the stories they tell me it's just I'm thankful that I haven't had to do that part of CF, but it's just the process is so tragic and brutal. And can you just kind of walk us through in detail, if you could, of how that was for you and like what you were thinking in that time or things that were crossing your mind, how you got through that? Can you just go into detail with that?
Yeah. I mean, obviously, so many things running through your head. Like, once you get the call, once you get to the hospital, it's like, oh, this is exciting, but it's also scary.
Right.
But also sad because of the donor family, like what they must be going through, because that's how the organs were given to me or going to be given to someone. Someone has to pass away. So that's
Right.
really, really hard and like sad. And so also scary and exciting 'cause it's like, it's a huge risk doing this surgery. Like, you don't know what's going to happen. Like, I just had to do the living will and the power of attorney
My
for this
gosh.
hospital. And it was like really hard to do because the language they use is like not easy to like figure out like, am I saying yes or no to this? So
Yeah, yeah, right.
I had to do that recently. And then it was hard because the first time we got wheeled away and I woke up and I didn't have the transplant
Oh my
from the dry
gosh.
run. So that was
Oh
I was
my
like, is that gonna happen again?
oh my gosh, that's so awful.
Um, but once I woke up, yeah, I was still intubated, so it's like really hard. It's really uncomfortable for anyone who's been intubated and awake. The breathing tube just sucks.
Can you explain what that is to people that don't know?
Yeah, so it's basically a tube that's down into your lungs to help you breathe until you can breathe on your own. It's typically used for surgery or people in like respiratory distress or something like that. Um, and so usually they'll take it out the next day or like a couple days, depending how the person's doing. And I'm like attached to so many tubes. I have like 5 chest tubes. I have like a neck IV. I have a port. I think I have like 2 in my arm. And there's so many wires. There's like a spinal tap
Oh my gosh.
thing in my back. And uh, they try to get you up and walking like immediately. So that was really hard because um, it's just, trying to get out of bed. I
Yeah.
like remember some of it. And my sister took videos and it took a while to like get me sitting and then gather all the wires and tubes and
My gosh.
it's a lot. And then you're actually handcuffed to the bed because when you wake up, some people
Mm.
don't know what's happening and they like rip things out. So like they make sure that you don't do that
Or they start getting aggressive with the nurses and the doctors, right? Yeah.
or that.
Yeah. Yeah.
Yeah.
Wow. So the process of the actual transplant, like walk us through the surgery, what you were feeling. Do you remember any of it or like walk us through the process? Because I know they have to break your ribs, correct? Cut open your chest.
Yeah.
Can you
So there's 2 ways that you can crack into someone's chest. You can either do a clamshell, which is like this, or I think this one's called a sternotomy, and you go like this. And then they use like, I think they're called retractors to like crank you open and keep you there. Um,
which one did they do to you?
the clamshell.
Ugh.
And then they also do that here. And so Minnesota, uses like Dermabond, like super, like some sort of glue for skin. And they didn't use staples, but they use staples here at Duke.
I
So that's
see.
going to be uncomfortable.
Oh, okay. So they crack open your chest.
Yep.
They break your ribs. Is that what they do?
Yeah, I guess, yeah, they just pull you apart.
Oh man.
And
And
so,
the process, obviously, they take the old lungs out, put the new lungs in. And
yep.
then what's that like waking up from that? Can you break that down?
Well, they got you pretty much a lot of
Sedate.
sedation and a lot of pain meds, and the spinal tap usually does it. So, like, I didn't really feel anything here, like the pain.
Hmm.
The pain mainly was in my back, like middle to upper. And I was like, why is my back hurting so much? Like,
Yeah.
it hurt worse than anything else. I was constantly uncomfortable. I could barely sleep. I could barely find like a position to be comfortable at. And so I'm already having anxiety about that happening again. But also like just laying in bed and sitting, like I've lost so much weight. It hurts to sit. I'm very bony and I can't sit in one position very long. So I'm already dreading laying in bed for so long.
My gosh.
So I'm already going crazy thinking about
What
it.
what do you do like in these situations? Is there something that you rely on, or like do you like is there how do you get through all this?
I don't know. You just got to dig deep and be like, hey, I got new lungs. I can
Yeah, you just take it
suck
day
it
by
up
day,
for a
right?
little bit and
Yeah.
I'm going to feel better.
Yeah. And I know this is a deep question, but I've thought about this with CF too, but do you about the part like that we can die from this? Does that cross your mind a lot, or because obviously you've had a pretty rough patch with it recently, but how do you deal with those emotions and those feelings?
Right. I know. And you would think, I don't know, some people think about it way more than others. And like that's all they think about. And I
Right.
think I just like, okay, yeah, sure. Obviously that's a possibility, but I'm not thinking about it every day.
Almost like do you try to block it out to a certain
Kind
aspect?
of.
Yeah, yeah, yeah.
Yeah.
And because it is difficult to kind of deal with that, right?
Yeah. And obviously with this fall and everything that happened with the rejection progressing extremely fast, it was really scary. Because I was losing lung function from like September 10th. I had PFTs. I was down to 60% already, and I was 108% in June.
Oh man.
And then from like September 8th, for 2 weeks, I dropped another 10. And then a couple days from 50 to 43. And then they're like, okay, we need to start some sort of treatment. You need to come into the hospital. We need to treat you. So I went in for 16 days, and everything they did it was like plasmapheresis. And so it basically is a process where they filter out your blood and they take all your um, albumin out, your plasma out, and so that's what has all the antibodies. And so then they give you albumin back so you can regenerate. So they do this every other day so you can regenerate your plasma. But I did it like 8 times, which
My
it was
gosh.
a lot. It's pretty aggressive. And a few other friends, and they said it would take 3 to 4 weeks to feel any improvement from all this. I just like felt worse and worse. And like a week or two after the hospital, I was already down to 27%.
Mm.
Um, so that was real fun. And currently I'm down to 19%.
Oh man.
So hopefully, I did have to do an injection called Campath. It's a one-time shot, and it basically wipes out your immune system. And the hope in that was to stop the rejection from going any further. And they said I might still go down a little bit and then level out. And I think I have leveled out now at 19.
Wow. So
Yeah.
they level your immune system in the hopes that the lungs aren't going to reject.
Or stop what's happening so I
I
don't keep
see.
losing.
So
Um,
how does that connect? I'm just asking because if you wipe your immune system out, right, your body has nothing to fight, correct?
it's so your body doesn't recognize the lungs as foreign.
So you're
It,
trying to trick the body into
yeah,
not.
that's what the immunosuppressant drugs are for, is to suppress your immune system so it doesn't attack your lungs.
I see. Okay.
Yeah.
How long did you have the original lungs before you started seeing a problem with the rejection?
like almost 7.5 years.
Okay. And is that like what dictates if someone is because some people have lungs and it doesn't happen to them, right? So what dictates the difference between someone having rejection and someone not? Do you know?
There's always, no matter what, someone's eventually going to get rejection. Like that's just inevitable. Um, and sometimes, like, yeah, the first year is the riskiest, and that's where things would go wrong or acute rejection would show up within that year. And then usually after year five, 50% of the population is prone to getting chronic rejection. And so originally, when we were going through this whole process, we they did the bronch, they did the clindamine test, but the bronch showed no cellular or acute rejection. And so we're like, okay, then what is it? And then this other test came back like 2 weeks later. And it's like, okay, you have donor specific antibody mediated rejection, DSA AMR.
Wow.
And so that's what all the stuff in the hospital did, was to treat that. But then after the hospital, they were like, actually, you now have chronic rejection. And so everything we did isn't going to work. And so that's why I had to do the CAM path. And when we started talking about, hey, I'm going to need another transplant, I don't know if I can recover from this, like, without getting one. So now it's called BOS, or CLAD rejection, which is chronic rejection.
Wow. So 7 years before the first one, and then so you started having some issues.
Yeah.
And it happened very quickly, the process, correct? Like it happens.
Yeah, it's beginning of September to now.
Wow. It's just, do you ever struggle with the feelings of like, why is this happening to me?
Yeah, but I'm not like, oh, woe is me kind of
No, of
thing.
course, of course. I mean, yeah, we have to stay strong and stuff like that, but it's always like, naturally we might ask ourselves a question when we're by ourselves, like, why is this
Okay, yeah.
happening to me?
It's like, why?
Yeah, like what is the purpose of all that? Have you ever analyzed that about your life and like figured out an answer maybe? Or is it just kind of like you're just kind of going through it as taking it day by day?
Yeah, yeah. I don't think too deeply about that. I know, like, it's just not worth the energy to create the anxiety and
Right.
the worry and,
Hmm.
the why and what ifs and
Right.
whatevers. Yeah.
I see. I see. Okay, so thanks for sharing that, by the way. I know sometimes it's hard. Okay, so we went through our first, you went through the first double lung transplant,
Hmm.
and then 7 years later, now we're trying to. Is it official that you're getting a second one, or where are we at with that?
Yeah. So I'm like accepted into their transplant program. I'm in the relocation phase. So, yes, I'm here in North Carolina, and I started pulmonary rehab, which is a requirement. They do it 5 days a week
And what does
for
that
like
entail?
15. Hmm?
What does that entail?
So basically, it's conditioning your body and your lungs to be at a good fitness level to recover for a
After.
transplant. It's really important to keep your legs and your core strong, because getting out of bed
Yeah.
is a lot. And people who go into transplant at a better physical fitness recover much better than people who don't.
Hmm.
And so Duke is really adamant about this. And so they don't call it that, but all the patients. So now I started calling it boot camp.
Yeah. Yeah.
It is. So I do 20 minutes of walking laps, because they have like a gym. And then however long does to do some weights and stretching. So every other day it's like legs or arms, and then 20 minutes on a bike.
I see. And how do you feel during that time? Are you like just out of breath the entire time?
Yes.
Yeah. Yeah.
Yeah.
Because you're at 19% right now.
Mhm.
And at what point do they put you on oxygen? Because I noticed that you have oxygen.
Yeah, I'm on it all the time now.
It's 24 hours you sleep with it and everything.
Yep.
And at what point do they give you that?
Uh, like mid to near the end of September.
And the what percentage was your lungs at that point?
It's crazy because before my transplant, I did not need oxygen until I was at like 19%.
Right.
But when I was like I don't even know when I was like 50% lung function. It was definitely like middle school or before that,
Wow.
that I didn't need oxygen. But I think I went on oxygen at 50%. I was like, what the hell?
Hmm.
I was like, why do I need it? And they're like, it's because it's the way the chronic rejection is, because it's obstructive airway situation,
I
is
see.
whatever they call it.
And for those of people that are watching that would don't know, I mean, we're saying rejection, right? But what is that? Like, what is actually happening in your body that so your body is it's a foreign object, obviously, it's been put into your body, and the body takes processing time to be able to reject it. So what is happening though? Like when you say rejection, like what is exactly happening to the lungs?
I don't know. I mean, I know that like like scientifically, I don't know,
No, no, no. I
but,
mean, just like yeah. Just okay. So
but just like the
are
body,
the lungs are failing, or they're not cooperating with the with your body anymore? Is that pretty much?
yeah, I guess. I mean, so the body now recognizes the lungs as
Yeah.
foreign, so they're attacking it. So I'm just whatever the chronic rejection is
So your
like,
body is attacking the lungs now.
yeah. I
Good.
mean, I
Okay.
think it's stopped now. Like
Hmm.
I've leveled out finally.
Yeah.
Because they really had to knock my immune system, I guess, was pretty high. Um, Even after all the stuff they did in the hospital, it was like they're like, this is weirdly high. Like you shouldn't be this high.
Mm,
So they're
interesting.
like, we need to do the campath shot. And I'm like, wonder if that's like why my immune system was so revved up. Because
Yeah.
like I hadn't been sick in like 2 years,
Wow.
like not a cold or anything. So I'm like, I don't know.
Wow. Interesting. And during the 7 years of the first transplant, do you have to take certain drugs to help prevent rejection?
Yes. Yeah. So they start you off like when you're, I think right before, well, at least in Minneapolis, they give you a dose before you go into surgery. And I think during the surgery, they give you like solumedrol, which is like a high steroid
Mm.
infusion. Um, and then obviously you start taking them after the surgery. And so immunosuppressants, you're usually on a couple. Prednisone is one of them.
Oh,
And some people take different ones, but it's usually tacrolimus and Cellcept, or instead of tacro, it's cyclosporin. So it's like either one,
and what do those do? They suppress the immune
yeah,
system?
suppress the immune system.
I see. I see.
But I remember it was really hard to swallow any pills. I just felt like so full and pukey. So it was like,
Mm.
took a really long time to swallow pills in the
Oh,
hospital.
man, jeez, it's so rough. Is it tough for you to eat right now?
Yes, yeah. I'm like barely eating. I'm basically just using my GJ tube, my feeding tube, to rely on all nutrition because I can't eat enough to gain anything. Like I'm eating applesauce and like yogurt just to take with my pills.
Yeah.
So I don't throw up, but I still throw up anyway sometimes.
Interesting. So you
I
get
don't know
sick,
why.
you get nauseous a lot with what's going on.
For some reason, yeah. And I asked some other transplant friends who have had like chronic rejection. They're like, yeah, they're like, your body's just so inflamed and just going through all this, just, your body hates everything. So it's just, they're like, yeah, I was puking a lot. And
Wow.
so it's real fun.
Man. Okay, so you're on transplant list is pretty much where you're at right now, right?
Not yet.
Not yet. Okay. So how
I
long does that process take?
It all depends. So usually they want you to do 23 days or 23 sessions in pulmonary rehab before getting listed. But many people have been listed before that happens,
Yeah.
like halfway through. Um, but for me, they do want me to do some more rehab, but also my vascular system's an issue because my SVC, which is a superior vena cava, which goes through the heart, one of the big main arteries, um, has a stent in it, um, a mesh stent to keep it open because I had a blood clot in there in 2013. And after the blood clot was gone, it left my vein stenosis, which means narrowed.
Oh
So
my
they took
gosh.
a stent in. And now, actually, this hospital stay, I created another blood clot in that same spot. And so they actually went in and took the clot out, which was wild. And
Gosh.
they're like, from the scans and whatever, the doctors was like, well, it looks narrowed. And I was like, well, make a judgment call if you need to change the mesh or whatever. And he didn't end up doing that. And so now here they're like, oh, well, that might be an issue. And it's not ideal, but we could change it during surgery. But like, I feel like they want to do it before then, but I don't know how that's going to work because they can't put me under general.
Gosh. So what caused the blood clot?
I don't know, but so I had it
And
was at
the doctors don't know at all. Like when if you ask them that, they have no idea.
they're all going to say it was because the end of the port line, the ports often cause blood clots, and that's where the blood clot was both times. But I hadn't had a port since 2018. They just put one in September
I see.
for all this. And so I got it September 30th. And by like in the beginning of my maybe 4 days into my hospital stay, I was starting to feel this like pressure in my face. I was like, oh God, this reminds me of when I had the blood clot. So it
Oh,
was basically like, feels like you're hanging your head upside down because the
the blood is rushing to your.
blood is not flowing back out because the blood clot is in the
Oh,
way.
oh,
And so for 2 weeks, I'm still dealing with this. And they're like, it's because they put a crazy line in my neck. And they're like, oh, it's because of the blood flow, and took it out. Anyways, I was like, can we please do a CAT scan with contrast instead of just an ultrasound? And what did they find? A blood clot.
oh my gosh. How many how many surgeries have you had?
Not that many, but I mean,
More than 10?
no.
No, okay.
I mean, I've had like 8 sinus surgeries. So I don't know if that counts.
Oh, really?
Yeah.
Connected to CF.
Yeah. It's
Yeah.
chronic sinusitis.
Yeah. And what is that for people that don't know?
Basically, your sinuses suck. No,
Yeah.
your inside sinuses create polyps.
Yeah.
And so they like kind of block like your airflow, but also then like stuff gets trapped in there and it like cements kind of. And so like you have sinuses up here.
Yeah.
They like the first couple they had to like drill in there.
Wow.
That was
Jeez.
really fun.
It's
But
brutal.
yeah.
How is your family doing with all this? How is your friends doing with all this? How's your community, and like do you have a support group around you, and how do they, help you during this time?
Yeah, I have a great support system here. Chaz is my partner, and he, had to take a leave of absence from work so he can come down and take care of me here. And then, so he's my primary caregiver. And then my sister Lima, she is my secondary. Um, she is in Colorado right now, but she's going to come right back once I get listed. And then my parents are in Massachusetts, but they're supporting from afar. And my brother is still in Colorado, and all my friends have been great. A lot of people say, "Let me know when I can come visit and help. When
Yeah.
can I come?" And so that's been great.
Okay, good. I'm glad for that. So we haven't been listed yet,
No,
and we don't know when that's going to happen.
hopefully in the next 2 weeks, they're like, "We want you to meet with another surgeon in 1 to 2 weeks to talk about the veins and the stent,
Jeez.
but also my weight
Right.
needs." I've like lost so much weight. They want me
Yeah.
to be at like a BMI
Hmm.
of 18 or 19 ideally. I'm at 17. So
Okay,
body
so
mass
you're
index,
not too far,
but I can't gain weight. It
yeah,
won't happen.
man.
It's insane.
It's crazy. It's crazy. And after you get listed, hopefully within the next couple weeks, then how close is the surgery for the next double lung transplant after that? Is it immediate?
I mean, no. So it all depends. Like you never know where you're going to get a call, and you could have a dry run, but
Ugh,
Duke has a very quick turnaround. Like they are known to, you're going to get, like, you're listed for a month, you probably get a call or two,
mhm,
or within 2 weeks, you have a call or whatever.
mhm. I
Yeah.
see. Okay, so a week or two. And as far as like financially, how does that work? Does your insurance pay for all this, or are you having to pay out of pocket for some of this? Because I know transplants are very expensive.
Yeah. So, yeah, insurance covers the transplant. And so you need a primary and a secondary. You need 2 insurances for this. And because my secondary is Colorado Medicaid, that is causing some problems. So um, I'm currently in the process of switching to a different secondary insurance that will cover me in both North Carolina and Colorado because I'm going to have to keep coming back here for up to a year for bronchs and appointments.
I see.
Because after 3 months after the surgery, I can go back to Colorado.
I see. So you have to stay there for 3 months.
Hmm.
Is that like the recovery time essentially? That's pretty much what that is.
Yeah, yeah, and they just want to,
Monitor
they
you and stuff.
do the pulmonary rehab for after as well, and just monitor you. And they're like, okay, now you can go home.
Wow. So you're kind of just sitting and waiting till you get the call, and essentially, right? That's
Yeah.
tough. And what do you do to pass the time?
Right now, I can't really focus, so I'm not reading anything. But I've been just watching movies and shows. I did bring
Yeah.
my like watercolor supplies with me, which I'll probably because I like doodling and
Okay.
art, but
Yeah.
um, not a whole lot I can do physically. Like we can't go do stuff around town or go for like I can't hike, obviously.
Yeah. 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 Because you enjoy hiking and things like that.
Yeah, and can't really just go eat in a restaurant because I have to stay away from germs, and I'm not really eating anything. So
And your appetite is pretty much just non-existent,
correct.
man. And what was your weight before this started? And what is it now?
It's like 105 now, and I think I was like 125.
Okay, so you've lost 20 pounds.
Yeah,
And what duration of time?
from September to now.
Okay, so a few months, 20 pounds. And it's impossible and yeah, it's hard to gain weight when you don't want to eat anything. And
Yeah.
there's no like, yeah, it's tough. There's no like mass gainers, but you can't keep anything down, right?
Yeah, I mean, I'll take a couple bites of something and then I'm like, I'm full or I feel like I'm gonna throw up.
And are you sick because are you on like I'm sure you're on some medications. Is that because they're like making you feel sick, or is it just because obviously you're just not feeling well in general and you just want to,
Yeah, I think it's just a mix of everything
yeah.
at this point.
Were you ever on Trikafta?
No,
No,
it
you
came
were.
out the year after my transplant.
Oh,
I know, and of course I have feelings like, oh, if only it happened earlier. But like even with me, because at the time of my transplant, I was at 16% lung function, and I'm like, I wouldn't have been able to really recover from that. Like, how much would Trikafta be able to do for me if you're already that low?
right,
Because
right.
I don't know if it can pull you out of that at all.
Yeah, yeah, it's tough. If you could explain to the viewers what it feels like to be at 16% lung function, how would you describe that?
Um, it's pretty hard to do anything. Um, but honestly, it's crazy. Whatever is happening now, I feel worse than when I did.
You feel worse
Because
now than before.
yeah, even though I'm not as low, it's the way the chronic rejection is. It's just like
Yeah.
so out of breath doing anything, like brushing my hair and brushing my teeth. I have to sit down to brush my teeth now,
Gosh.
which is crazy. I don't remember having to do that before,
Yeah.
but I was able to do a little more stuff. Maybe, maybe not.
And your body's been through a lot. I mean, your body's, and as we get older, it's also tougher for the body to recover, right?
Yeah.
Were you very sick as a child, or did you you got more sick in your adulthood?
Yeah. I it started getting worse like middle school, high school, college.
Okay.
Like I got my port placed in 2005, so I think that's middle school or high school. I don't even know. I graduated in 2008.
I see. I see.
Yeah.
Well, I appreciate you coming on today, and I know it's been a lot, and I really hope that you get better. I'll be praying for you, and I hope that it all works out for you. Is there anything that you want to add before we go?
Um, I mean, I know people say this all the time, but like, don't take for granted your time. Like, be thankful for being able to do the things you can do, that you can walk out of this house and go do stuff without being attached to oxygen, that you're not, gasping for breath when you're trying to take
Yeah.
a shower.
Yeah.
You don't have to sit in the shower. Um, and just, hug and love your loved ones and make memories and just spend time with people who matter and do as much as you can. Like I hiked as much as I could. I did a couple 14ers this summer. And I was going to the gym like 5 days a week. I was very, very active and I did not take it for granted. I like used all my physical ability as much as I could. I would go camping, I would go snowboarding, and it's like, and now like I can't do any of that. But like I use those memories to get me through
Mm.
rehab. And I know I'll be digging deep with those memories during the, you know, process after transplant recovering. So yeah,
Yeah.
just
Okay. Yeah. Well, absolutely not take your life for granted. And people don't realize how important it is just to have a breath, and they go through a whole life without even realizing that it's something that can be taken from you at any moment. It
yes,
gives you a new
exactly.
lease. It gives you a new lease on life. Absolutely. That's,
100%.
yeah, absolutely. Well, thanks for sharing that. Can you just tell our viewers how they can, find you on social media? And I ask everybody who's watching this, please maybe send you a nice message of support and follow you. And, because sometimes that keeps us going. You know what I mean?
For sure.
Can you tell them?
Yeah.
Yeah.
So my Instagram is long story short. It's a pun. So long underscore story. Yeah. There's an underscore between each word.
Okay.
And then I have Facebook. I'm not really on Facebook. I do have a TikTok, but I'm mainly on Instagram and then YouTube. I started a channel, but I haven't posted recently.
Gotcha. Gotcha. We'll have everybody try to follow you and send you some messages. I appreciate you coming on today. And like I said, we'll be praying for you. And we hope that, if you need any support from me, obviously you can reach out. But yeah, I think we met through Breathe Strong. Did we meet through Breathe? I thought we knew each other before that, though. Maybe.
I think it was through Colton's
Under.
legacy thing.
Yeah. Yeah.
Foundation.
So we've known each other for quite a while through social
Yeah.
media. And then we ended up working with the Breathe Strong stuff. Yeah.
Yep.
Okay, well, please follow her and send her some motivating, inspiration, loving messages to get her through this tough time. And I thank you for coming on, and we'll be wishing you the best and praying for you.
Thank you so much for having me. This was
Abs-
awesome. I'm glad I could help and share some insight and maybe help someone going through the same exact situation.
Absolutely. Absolutely. It's very much needed, and I appreciate it. Thank you.
Thank you.
All you guys, make sure you guys subscribe to the channel, and we'll be back next week for a new episode. Thank you guys for watching.